Dr. Suhas Shetty today will elaborate on applications of Rasaushadhi in Manas Roga. Over to you, Dr. Suhas Kumar Shetty.
Hi, Bhuvan. Namaste. Let me thank Shri Dhootapapeshwar Limited for this wonderful opportunity to be a part of Rasashastra Sambhasha 2024. And in today's session, I'll be sharing my clinical experiences of managing few of the commonly encountered mental disorders in Ayurveda through Rasaushadhis. So the learning points or the learning objectives of today's presentation would be on knowing a little bit about an overview of what do you mean by mental health and mental disorders and how we look in such conditions in Ayurveda. And more than that, we'll try to see what is the role of Rasaushadhis in the management of various psychiatric disorders. Whenever we talk about mental health or mental disorders, sometimes it's very easy for us to define or understand various psychological, physical disorders. But when it comes to psychological disorders, sometimes it is really challenging as a clinical practitioner because of the awareness, social stigma, as well as the accessibility for the expertise that we have in this field. That's the reason why identification of the psychiatric disorders is always a challenge in Ayurveda as well as in any mental health issues. Ayurveda strongly believes in the tripod that we always talk about, the Sharira, Sattva and Atma. And whenever we are talking about health, you're talking about disease, you're talking about management, we always take this holistic approach for its management. We've talked about health, and Ayurveda defined this as Samadosha Samagnishta Samadhatu Malakriyaha Prasanna Atmendriya Manaha Swastha Ityabhidiyate. See, the use of the word is very, very prominent there, where we use the word Sama for various physical entities and use Prasanna, which talks about more of well-being, wellness in terms of the psychological effects. Basically, the mental disorders is defined as where there is an issue with the cognition, issues with the people, where we think, where we act, and how we behave in our routine life. And it should not be because of any other disorders which can be coming under the compartmental of its diagnosis. Even if you look at the details that we find in Charaka Samhita, especially in the Unmada chapters, we get a lot of details in terms of how do you approach psychiatric disorders in Ayurveda, how do you approach such conditions, how do you do the examination part, and how do you manage them. And if you look at this shloka, it also mentions about that the wellness of the sense organs, its intellect, self, and the mind are an indicative of the mental health in Ayurveda. So we are talking about various categories of psychiatric disorders. What have patients come to an Ayurvedic practitioners in terms of mental health? The people could be mentally well, but still they want to improve their mental health, or they might be at the risk of developing some psychiatric disorders. Maybe they had some psychological issues at the previous period of time, or there was some family history of some psychiatric disorders. So these are the people who are at the risk of developing psychiatric disorders in the due course of time. Of course, there are various common and severe mental disorders. So let's just see a few of the conditions that we commonly counter in our psychiatric practices. I'm not going to talk detail about that, but very importantly, what are the common psychiatric disorders or mental disorders that we come across in the psychiatric practices. The most important common conditions that we come across very extensively are different kinds of depression with so much of maybe people are not willing to act, not willing to talk, not willing to work. They feel that they are helpless, they're hopeless, they're worthless, and they really sometimes have a lot of suicidal activities. And these are very, very potent people who can be very well be managed by Ayurvedic psychiatric patients. Then we have the next category of patients who are anxiety disorders, who can be from children, they could be from adults, they could be elderly populations who are having various types of anxiety disorders. Very commonly, like generalized anxiety disorders, obsessive compulsive disorders, phobic disorders, panic disorders. So these are the different categories of the anxiety disorders. Of course, there are some major mental disorders, like we have the bipolar disorders, we have schizoaffective disorders, schizophrenia, different categories of schizophrenia. Again, these are conditions which are very good models for integrative practices, where the patient is already on some contemporary practices or medications like antipsychotic medications, and we can always do very well, combine them with Ayurvedic treatments and do wonderful improvement in their quality of life. There are different types of seizure disorders, epilepsy and other convulsive disorders which also can be managed very effectively with the help of Ayurveda, where I'll be sharing few of my experiences regarding that. Again, in this we have different categories, like we have the seizure disorders in children, we have in adolescents, we have the problem in the elderly patients, we have in women, where there are different kinds of the seizure disorders. One of the very important areas where we have been working about, where we have established an exclusive psychiatric de-addiction center in Ayurveda, where we can use different kinds of therapies and treatments in the management of various substance abuse disorders, especially the alcohol use disorders. Of course, I think one of the areas where we have been working recently is establishing a neurocognitive center, where we can manage various types of neurocognitive dysfunctions like dementia, Alzheimer's dementia, Parkinson's disease, other age-old disorders with the help of Ayurveda. One of the potent areas again where we can use various types of medications in Ayurveda is insomnia. So these are some of the common type of conditions that are seen in our practices, and this is what is some of the few of the experiences that we have for the last 2.5 decades in the management of various psychiatric disorders. How do we categorize them? No, basically for the diagnosis through Ayurveda, it's very important we categorize them under a category of basically Kevala Manasika Rogas, Ubhayashrita Manasika Rogas, Nanatmaja Manasika Rogas, and the Mano Adhishtita Manasika Rogas, where the Kevala Manasika Rogas could be various types of emotional disorders, depression, anxiety, the Nanatmaja Vikaras, which are because of Vata, Pitta and Kapha. Then we have the Sharirya Mano Adhishtita Manasika Rogas like Unmada, Apasmara, Atatva Binivesha, Madatya, etc. And most importantly, where the effect can be on the body, like Bhaya Jati Sara, Shoka Jati Sara, etc. And now, how do you approach such conditions? The most important thing is, just because patient has some psychiatric problem, do not jump into a conclusion that they have some psychological disorders. Because so many physical diseases, like for example, mitral valve stenosis, endocrine dysfunctions, hypothyroidism, endocrine dysfunctions, can also have psychiatric presentations. So always try to rule out the possible physical conditions, possible growth and developmental disorders, and see that there is some strong stress factors coming to the causation of this disease, and that is how we should come out to the diagnosis of some psychiatric disorders. Now coming to the management, how do you manage such conditions in a Ayurvedic setup? If we have an extensive Ayurvedic clinic or an Ayurvedic hospital, or if we can do at an OPD level, how we manage that? As you know, in Ayurveda we talk about the basic 3 line of treatment: Daiva-Pashraya, Yukti-Pashraya and Sattvaja line of treatment. But in this presentation, I'll be restricting to only the usage of Rasaushadhis in the management of psychiatric disorders. Now, why Rasaushadhis? Why we need Rasaushadhis, and how it is important for its management in various psychiatric disorders? Because, see, there are 3 main categories of the preparations which are very extensively used in Manas Rogas. One, different kinds of Grita preparations, because as you know, it is a very potent neurotropic drugs which can cross the blood-brain barrier and be very effective. Various categories of Grita preparation like Kalyanaka Grita, Mahakalyanaka Grita, Pranchagavya Grita, Paishachika Grita, Purana Grita, they are very extensively used in psychiatric disorders. Other one is use of Asavas and Arishtas, because they also cross the blood-brain barriers and various types of Asav-Arishtas like Sastarishta, Ashwagandharishta, Balarishta, Pipalyasava, etc. They are very extensively used. And then the different categories of the Rasaushadhis, because they are used in Alpamatra, they are Shigrakari, Vyavai, Ashukari, we can extensively use in psychiatric disorders. So what I'll be probably sharing in my experiences for a few minutes is the use of few of the single drugs and the compound drugs, and also share few of the recently conducted research that we did with Dhootapapeshwar Limited on a product and its clinical experiences. So the most commonly used Rasaushadhi that we do in the Manasroga is the use of the Swarna Bhasma, which is especially used in the diseases like Unmada, Apasmara, Chittodvega, Brahma, Glani, etc. Commonly, this Swarna Bhasma is used with Rasa Sindura, 125 mg, Abraka Bhasma, 375 mg, with Shankapushpi Choorna, 3 to 5 grams. Rajata Bhasma is also a very potent Buddhi Meda Vardhaka, and especially it is used along with Sita, Grita, and Ela, and it can be used in especially in the Vata dominant types of Madatya conditions, especially with Rajata Bhasma. Then the Tamra Bhasma, which is especially used in the seizure disorders like Apasmara, etc. That too, when there is Kapha dominant or Safena Yukta Akshepaka is present, we can use Tamra Bhasma, which is given along with Kajjali and Rasa Sindura. And in case of Murcha, you can use Tamra Bhasma with Ushira Choorna and Naga Kesara Choorna. And especially in Brahma, where there's giddiness or hypovolemic convulsions are present, Tamra Bhasma is given along with ghee, and then you can use around 1 to 2 palas of Duralabha Kashayas. The Vanga Bhasma is also very good, especially in case of chronic disorders, chronic psychiatric disorders. Those patient is already on some psychiatric medications because they have some form of reduction of various micronutrients. You can use the chronic patients, you can prescribe the Vanga Bhasma. Again, the Loha Bhasma can be used in the Manashiti Litara, where there is feeble mindedness, mental weakness. Those who have depression, we can use Loha Bhasma. One of the very good medicines, especially for insomnia. Insomnia, you get this reference both in the Rasa Samuchaya as well as Vaishya Ratnavali, use of Swarnamakshika Bhasma. Haratala Bhasma, especially it is used in case of Apasmara, and especially Apasmara it can use along with Vacha Choorna as well as Chiraka Choorna. Abrak Bhasma is a very good, especially in the most of the Pitta dominant conditions like mania, bipolar disorders, aggression, teenage aggression, especially in children. You can use this to a very good effect, like in Pittaja, Unmada, Apasmara, Madatya, bipolar disorders like unipolar, bipolar disorders. We can effectively use the Abrak Bhasma. Again, Rasa Sindura can be used in Apasmara, Unmada, Murcha. Especially in Murcha, it can be used along with Pipali Choorna, and Madhu Lehana can be done, and then followed by the Shita Jalasnana. Prabhala Pishti is also very useful in case of Manodorbalya, where it can be used along with Grita, Navnita, and Madhu. Mukta Pishti, especially in case of if the patient has too much of irritability, anxiousness, nervousness, trembling, it is one of the very good prescription that we can add the Mukta Pishti to your prescriptions. These were some of the single drugs that we are being able to use in the various types of psychiatric disorders. Coming to few of the compound preparation which we commonly use in preparation is the Smriti Sagara Rasa, especially in cases of Apasmara as well as in cases of dementia. It can be used with water or with honey. This is again outcome of one of such studies where the effect of Rajata Bhasma was combined with Smriti Sagar Rasa in patients of Parkinson's disease. Then though Shwasakudva Rasa is indicated in respiratory disorders, especially we use in case of seizure disorders, especially if you want to have the immediate reduction in the seizures. We can use this as a Pradhamana Nasya either with Shwasakudva Rasa, like 2 to 3 tablets of Shwasakudva Rasa, you can make it to powder we can use as the Dhapana or the Pradhamanasya. We can also use the Choorna of Vacha or Katphala in the management of acute attack of apasmara. Then Ananda Bhairava Rasa, especially in case of Vataja apasmara, where there's convulsions is there in spite of patients on medications, we can effectively use the Ananda Bhairava Rasa. Then especially in Pittaja Unmada, we can use different kinds of Lagu Sutta Sekara Rasa. Mahavatva Vidvamsa Rasa, again you can use in case of Vata Vyadhis, and also in case of neurodegenerative disorders, one can effectively use the Mahavata Vidvamsa Rasa along with Eranda Taila, Ardhaka Swarasa and Bringraja Swarasa. Again, this is one of the very popularly used in my practice, the Unmada Gajakesi Rasa, which we use in different kinds of Unmada, especially the chronic patients, unresolved patients, treatment resistant schizophrenia. Unmada Gajakesi Rasa is very, very effective. Again, this is one such review which has the role of Ayurveda in the management of psychotic disorders, where one of the main usage was of the Unmada Gajakesi Rasa. Then Unmada Gajankusha Rasa also can be used, and this is a study which compared the Panchakarma as well as Unmada Gajakesi Rasa in the management of major depressive disorders. Especially in case of depression, patients can be used with the Unmada Gajankusha Rasa. Again, Brahmi-Vati is also one of the very popularly used. I use this very extensively, starting from pediatrics to the geriatrics. It can be used in different kinds of course, in different dosage forms, in different forms, in different anupanas. We can use in different, even a small literature of the monograph have been written on Brahmi-Vati. And this is one of the publications that we have from our institutions on efficacy of the Brahmi-Vati in generalized anxiety disorders. And of course, one of the most popularly prescribed prescription that almost I use, at least out of 10 patients, 6 to 7 patients are prescribed with Manasamitra Vati, which is again a polyherbal combinations used along with Madhu, Jata Mamsyadi Kashaya, Dashamula Kwatha and Drakshadi Choorna. So this is again one of the publication of our institution we have. We just had one of the very recently concluded a big clinical trial, which was again sponsored and conducted by Shri Dhootapapeshwar Limited, on the role of a proprietary medicine called as Medhasagar Rasa in mild neurocognitive disorders. Especially this is a proprietary medicine, and which the study we conducted on 30 participants of mild neurocognitive disorders, and this was published in a very reputed journal just a couple of weeks back. And it mainly contains, it's a polyherbal combination which mainly contains Mahakalyanaka Vati, Smriti Sagar Rasa, Rajata Bhasma and Abraka Bhasma, and processed with major rasayanas like Manduka Parni, Shankapushpi, Guduchi and additional herbs like Ashwagandha and Haridra. So what we did is we took 30 participants who were recruited for the screening, and all of them completed the studies. The median score of the MOCA, which is a standard scale which you use for the mild cognitive impairment, where there was reduction from there's an increase from 20 to 25, and then also all the scales like BCR scale, we use the Hamilton scale, Pittsburgh's sleep index scale, where there was a significant increase in most of these parameters. We also use the basic Ayurvedic parameters like especially the Manasika Bhava scale, where there was a significant reduction. And at the same time, we could not find any adverse effects because of that, and more than 80% compliance was observed in this particular studies. So the conclusion of this study was that this can be very effectively used in various cognitive functions and relieves anxiety, and sleep problems were very effectively improved in age-related mild cognitive disorders, which really offers a very promising therapeutic actions. So to conclude, so these bhasmas which are used in the formulations either as single or they're used in polyherbal combinations can be very effectively be used in, like, because most of the bhasmas are Tridosha Hara, and they have Rasayana, Medhya and Smriti-Prada. At the same time, the very important thing are the various Bhavana Aushadhis that are used in these medications, which sometimes are Tikshna, Ushna Gunas, which again helps in the management of Vata and Kapha doshas, which are generally useful for various types of psychiatric disorders. So with this, I would like to once again thank the entire team of Sri Dhootapapeshwar Limited, and special thanks to Sri Randik Puranik Sir, Dr. Ketan and Dr. Mukesh Chawda Sir for this wonderful opportunity. Thank you very much.
Thank you, Dr. Suhas Kumar Shetty, for the information that you shared with us with your expertise. And I invite you to remain on stage and to accept this token of appreciation presented to you by one of the co-chairs of today's forum, Professor Mrs. K.R. Veerasekara. Thank you.